name's Kimberly. I'm a CTC nursing student, and I'm going to be your nurse assessing you today. Is that going to be okay?
Yes.
Okay. Can you tell me your name and date of birth?
Virgil Farmer, June 15, 1974.
Is it okay if I call you Mr. Farmer, or would you rather me call you Virgil?
Virgil's fine.
Okay, I'm going to check your armband. Okay. Okay, Virgil. We're going to do a head-to-toe assessment. I'm going to start with your head and work all the way to your toes. It's going to take a little bit of time. So is there anything I can do to make you more comfortable, or do you need to go to the bathroom or anything?
No.
Okay, I'm going to wash my hands. We're going to get started. Okay, I'm going to apply privacy. I'm going to come in. I need to ask you a few more questions before we get started. Are you allergic to anything, Mr. Farmer?
No.
Okay, are you in any pain today?
No.
Okay, can you tell me where you're at today?
I'm getting a physical
Okay,
checkup.
and do you know what day it is?
Sunday.
Okay, and do you know who the president is?
Donald Trump.
Okay, so my patient, Mr. Farmer, he's alert and oriented ×4. Okay, next we're gonna start with the head, and I'm gonna work my way down. Is it gonna be okay that I touch you?
Yes.
Okay, Mr. Farmer. First, I'm going to inspect the head. I'm looking for symmetry. Make sure you don't have any lumps, bumps, or bruises. I'm also going to be checking skin for moisture, anything like that. Also, I'm going to be checking for alopecia, which is hair loss. Also, for any infestation. You let me know if there's any tenderness, anything hurt. Okay, I don't see anything. I don't feel anything. Everything seems to be fine. No infestations, no alopecia. Okay, everything looks good there. Next, I'm going to be assessing cranial nerve number 7. I need you to do a few things for me. Can you wrinkle your forehead? Can you close your eyes real tight? Okay. Can you puff your cheeks? And can you smile real big for me? Okay, we just assessed cranial nerve number 7. That's intact. Next, I want to assess cranial nerve number 2, which is your optic nerve. Can you read this top line of this card for me?
Customized bathroom solutions.
Okay, so we just assessed cranial nerve number 2 is intact. Next, I'm going to assess the eyes. I'm going to be looking at the eyebrows, eyelashes. Also going to palpate the eyelids, the lacrimal ducts, and to check for any puffiness, swelling, drainage, anything like that. When I palpate the eyelids and lacrimal ducts, I need you to let me know if there's any tenderness, anything going on there. Nothing there. Does it hurt? Any
No.
sore? Okay, no drainage. Also, I'm going to be checking the sclera of the eyes, checking color. Everything looks good. Next, I need to check your perla, which is to check to see if your pupils are equal and reactive. I'm going to use this little pen light. I need you to look at me. I'm going to shine the light in, see if your pupils constrict. Okay. And they do. Okay, so perla is good because pupils are equal, round, reactive to light. Next, I'm going to check accommodation. I need you to follow my pen light. I'm going to move it inwards towards your nose. I'm going to check accommodation. Ready? Okay, his accommodation is good. So perla is normal. Okay, next I'm going to check cranial nerve 3, 4, and 6. We're going to be doing the 6 cardinal fields of gaze. I need you to watch my pen light with your eyes. I need you to follow it with your eyes, not with your head. So I need you to follow this with your eyes, okay? Here we go. Okay, so we just checked cranial nerve 3, 4, and 6, and they are intact. Okay, next I'm going to palpate the temporal pulses. One on both sides. We check those bilaterally, and those are both 2+. Next I'm going to check the frontal and maxillary sinuses. I need you to let me know if there's any pain or tenderness. Any pain or tenderness? Okay, we're going to check here, pain or tenderness.
No.
Okay, no pain or tenderness there. Okay, next I'm going to inspect the nose. I'm going to palpate the septum. We're also going to check patency of the nares. When I check patency, I need you to put one finger on the right side of your nose and take a breath out of the other. Okay, I need you to do it the opposite side. Okay, patency is good. I also need to palpate the septum, make sure he doesn't have a deviated septum. Any pain, anything hurt here?
No.
Okay, I also need to inspect the inside of the nose. I'm going to check for any lesions, any blockages, anything up in there, drainage. Everything is normal. Next, I'm going to go ahead and inspect the mouth. We're going to check for any dry mouth moisture, check for any lesions. We're also going to check for caries or any odor inside the mouth. Can you open your mouth for me and let me look inside? Okay. And now can you stick your tongue out and say ah? Okay, when we do that, cranial nerve number 10 is intact. Also, while we're here, can I check cranial nerve number 12? I need you to stick your tongue out and move it side to side. Okay, cranial nerve number 12 is intact. Okay, next we're going to go to the ears. I'm going to inspect, look at the ears for any swelling, edema, temperature, discoloration, drainage. Need to look at both sides. Also symmetry, need to make sure his ears are symmetrical. I also need to palpate the auricles and the tragus, and you let me know if there's any tenderness, anything sore. Also checking for any nodules. Is anything sore or tender?
No.
Okay, we're gonna palpate the tragus. Anything sore here?
No.
Okay, I'm gonna check this side. Tragus. No. Anything sore? Pull it up, look inside. Okay. Nothing sore? Everything's good? Okay, we're gonna assess cranial nerve number 8. I'm gonna do a finger rub test. Let me know if you can hear me.
Can hear you.
Okay, I'll do this one.
Can hear you.
Okay, cranial nerve number 8 is intact. Next, we're gonna go and palpate the lymph nodes. We're gonna start at behind the ears, actually the back of the neck, and we're gonna work forward. I'm gonna feel back here at the base of the neck. I'm gonna go behind the ears. Anything sore, tender, I'm inspecting for nodules, swelling, any lumps, bumps, anything tender?
No.
Okay, and then I'm gonna work my way down the jugular pathway over onto the clavicular area. Nothing sore here?
No.
Okay, lymph nodes are normal, nothing swollen, no nodules, everything feels good there. I'm also assessing the neck for temperature, symmetry, alignment. I also need to inspect, can you lift your head up for me? I inspect the trachea, and you look to make sure it's properly aligned. Also need to palpate, make sure we don't have a deviated trachea. Everything seems normal there. Next, I need to check range of motion. Can you lift your head up for me? Can you lower your head down, chin to chest? Okay. Can you do your ear to shoulder, right to left? Okay, range of motion is good. Flexation is good there. Next, I'm going to palpate the carotid arteries. We do those one at a time. Okay, left side is 2+. And check right side. Right side is 2+. Next, I need to get my stethoscope. And we're going to listen for any breweries. Those are swishing sounds. I'm going to use the bell of my stethoscope and check for breweries. I need you to take a deep breath and hold it for me. Okay. I'm going to check the right side. Take a deep breath and hold it. Okay. No swishing sounds, so there's no sounds of breweries there. Okay. Next, I'm going to go ahead and assess respirations. I'm going to be assessing those for 1 minute. I'm going to check rate, rhythm, and depth. Okay, respirations are at a normal rate and rhythm. Intensity is good. Rate and rhythm is normal. A normal rate and rhythm for respirations is 12 to 20. His are at 16. That's good and normal. Next, I'm going to be listening to the lung sounds. We're going to start at the apex, which is the top of the lung, and we're going to work our way all the way to the bottom, to the base of the lung. I'm going to be listening for any adventitious sounds. I'm going to be listening for any rhonchi, wheezing, crackles, anything of that nature. I'm going to start here above the clavicular on the right. I need you to take a deep breath for me. Okay. You're going to take another. Take a deep breath for me. Another. One more. Again. 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 One more. And again. Okay, I'm going to listen bilaterally. On the right side, we have the right upper lobe, middle lobe, and lower lobe. I'm going to listen. Take a deep breath for me. And here, take a deep breath. And again. Okay, I need to compare the sides. Left side. Left lower. Okay, one more. Okay, they both sound normal. No adventitious sounds being heard. Next, I'm going to be assessing the heart sounds. I'm going to be listening for abdomen, which is aortic, pulmonic, herbs, tricuspid, and mitral. I'm going to be listening for any irregular heart rhythms, any heart murmurs, anything of that sort. Also, I will be checking pulse deficit. When I check the radial pulse, if there's a difference between the radial pulse and the point of maximum impulse pulse, I will subtract them, and that will be your pulse deficit. Right now, I'm just going to listen to the heart sounds. We're going to go second intercostal on the angle of Lewis, and then go second intercostal space. On his right side is going to be the aortic. I'm going to listen. You're going to be listening to the. This is pulmonic. This is going to be the herbs position. Tricuspid. And the point of maximum impulse is going to be mid-clavicular, even with the breast line. It's going to be underneath the breast. It's going to be at the fifth intercostal space. It's also called the point of maximum impulse. Heart rate and rhythms are normal. I don't hear any heart murmurs, anything irregular. I'm going to go ahead and listen for 1 minute. Okay, everything sounds normal there. I'm going to go ahead and palpate his brachial pulses and then his radial pulses. And if there's a difference between the PMI and the radial, then I will let you know if there's a pulse deficit. Let me go ahead and palpate your brachial. Those are bounding in 2+. Okay, I'm gonna go ahead and palpate radials. Those are 2+. I'm gonna go ahead and check your radial pulse. Okay, radial pulse and the mitral, which is the PMI pulse, are both equal. They're both at 82, so there's no pulse deficit. Also, I need to check flexation of the upper extremities. I'm going to put my arm under your elbow, and I need you to flex your elbow for me, out and in. Okay, and then right side. Okay, flexation is normal. Okay, I need to check your hands, arms for moisture, edema. I also need to check your capillary refill. That's less than 2. Okay, I'm also checking fingernails for clubbing. Everything looks good and normal there. Capillary refill there is less than 2. Okay, no signs of edema or anything there. Also, then I need to check strength in the your strength, muscle strength in your upper extremities. I'm going to give you my 2 fingers on each side. I need you to squeeze bilaterally. I need to see if your strength is equal. Okay, strength in both hands are equal bilaterally. I need you to push against my hands. Okay, I need you to pull against my hands. Okay, strength in both upper extremities bilaterally are equal. Next, we're going to go to the abdomen. I'm going to be looking at the abdomen for any lumps, bumps, masses, any scar tissue, any hernias or anything like that. I don't see anything out of the ordinary there. Next, I'm going to auscultate and listen. I'm going to listen for bowel sounds. I'm going to listen starting at the right lower quadrant and work my way around to the left lower quadrant. I'm going to listen for bowel sounds. Normal bowel sounds are going to be anywhere from 5 to 30 within 3 to 5 minutes. If you don't hear any bowel sounds at all, that's going to be hypoactive. If you hear more than that, it's going to be hyperactive. I'll tell you what I hear in just a minute. We're going to start here on the lower right quadrant. All right, upper quadrant. Left upper quadrant. Left lower quadrant. Okay, bowel sounds are normal. Now I'm going to palpate. I'm going to feel to see if I can feel any masses. You tell me if there's any tenderness, anything hurts. I'm looking for guardedness, any lumps, bumps, abrasions, bruising, scar tissue, hernias. I'm going to feel. I'm going to start at the right lower, go up to the upper. Tell me if there's anything hurting you, anything tender. Left upper, lower. Okay, anything hurt there?
Nope.
And then I'm going to go all the way across. Anything hurt there?
Nope.
Now I'm going to go deep palpations. Anything hurt?
No.
Okay, everything seems to be normal there. Okay. Next, we're going to go down. I would be checking his inguinal lymph nodes. It's going to be in the groin area. I would be checking for any nodules, lumps, any tenderness, swelling, inflammation there. Also there, I will be checking the femoral arteries. If they're normal, they would both be 2+. You would check those there as well. Next, I need you to turn sideways. I'm going to go ahead and auscultate the posterior chest wall. I need to listen here. Now listen for the posterior for the lung sounds. I'm going to start at the apex. Can you take a deep breath for me? Again. Okay, we are listening for any adventitious sounds. Again. And again. And again. One more. One more. One more. Okay, no adventitious sounds of the lungs. Also, while I'm back here, I'm just looking for symmetry, making sure his scapulas are aligned properly, making sure he doesn't have any curvature of the spine, and make sure his vertebrae are in line. Starting at C7 and going all the way down to the lower lumbar. Everything seems to be nice and straight. Everything seems to be symmetrical. Okay, can you turn back around for me, sir? Okay, next I'm going to be assessing the legs, ankles, and feet. I'm inspecting, I'm looking to see if there's any color, discoloration of the skin. I'm also going to be checking for temperature, moisture, dryness, edema. Also, I'm going to be checking for muscle strength in the legs. Next, I inspected them. I don't see anything out of the ordinary. No color distribution. Let me feel. I don't see any edema. No bruising, no lesions. I'm going to go ahead and check muscle strength. Can you push out? Okay. Can you pull back? Okay. Can you do it with your left? Push out. Pull back. Okay. Muscle strength bilaterally is good. It's normal. Next, I'm going to be checking the popliteal pulse. It's going to be behind the knee. Left one is 2+. I'm going to do the right. Okay, and it's 2+. Okay, next I'm going to be checking the pedal pulses, which is going to be the posterior tibialis, which is going to be inside of the ankle, and that's 2+. Let me check this one. That's 2+. And then I'm going to go ahead and check the pedal pulses, which is going to be on the top of the foot, in between where the big toe and the second toe go. That's 2+. Let me see this foot. Okay. It's 2+. Also, I'll be checking the feet for any edema, swelling, any pressure sores, any lesions, bruising. Also, I will be checking the nail beds for any ingrown toenails, any nail fungus, any fissures, lesions around the toes, bottoms of the feet. I would be assessing them. His are normal. Also checking the toenails for capillary refill. If you push the toenails and capillary refills come back within 2 seconds, that's normal. Next, Mr. Farmer, I need to assess your gait. I need you to stand up and walk for me. I'm going to check for coordination and balance. If you'll walk a few steps for me and then walk back. Okay, everything is fine and normal. Okay, can you turn around for me? Coordination is good, steady. We're going to do a Romberg test. I'm going to be standing right here. I'm going to put my hand in front of you and one behind you. I need you to close your eyes, put your hands straight out in front of you. I'm checking for balance and stability. Okay, Romberg test, that's good. You can open your eyes and put your arms down. Okay, next, I need to check your cerebellar function. I need you to put your arms out beside you, close your eyes. I need you to take your index finger on your right hand and touch your nose, and then do it on the other side with the left. Close your eyes. Okay. Okay, cerebellar function is normal. Okay, that would be good. Next, can you turn sideways for me? I'm gonna go ahead and check the back for symmetry. Everything looks normal there. And like I said, spine is normal, no curvature of the spine. Everything is aligned, scapula is aligned. Everything looks good. Okay, you can have a seat. Mr. Farmer, is there anything else I can do for you today?
That's it.
Okay, I'm gonna go ahead and wash my hands and document, and you have a great day.
You too, thanks.